Complete spinal cord injury above the sacral spinal cord but below the area of the sympathetic outflow results in all the following except A. Detrusure overactivity, B. Striated sphincter dysynergia, C. Smooth sphincter dysynergia, D. Absent sensation below the level of the lesion. And the answer is A. Detrusure overactivity. Explanation for this question is a complete spinal cord injury above the sacral spinal cord but below the area of sympathetic outflow affects the neural pathways involved in bladder control. The sacral spinal cord, S2-S4, contains the parasympathetic nervous system outflow that controls the detrusure muscle, the smooth muscle that forms the bladder wall. When there is a spinal cord injury above the sacral level, the connection between the brain and the sacral spinal cord is disrupted. This interrupts the normal inhibitory signals from the brain that prevent involuntary bladder contractions. Without this inhibitory control, the detrusure muscle becomes overactive and contracts involuntarily, even at low bladder volumes. This condition is known as detrusure overactivity or neurogenic detrusure overactivity. Detrusure overactivity can lead to several consequences. 1. Involuntary bladder contractions and urinary incontinence. 2. High intravesical pressures, which can potentially cause kidney damage. 3. Incomplete emptying of the bladder, leading to urinary retention and increased risk of urinary tract infections. The other options listed, B. Striated sphincter dysynergia, C. Smooth sphincter dysynergia, and D. Absent sensation below the level of the lesion, are expected consequences of this type of spinal cord injury, but detrusure overactivity is not typically seen because the injury is above the sacral level, which is responsible for the normal parasympathetic control of the detrusure muscle.